without falling apart. That might work. Can you see that without
Yeah, oh, it's good.
glare? Okay,
Yeah,
good.
no glare.
Okay, so one of the things that we had a question about this week was something I want to answer straight off the bat, which was, when the weather changes, why do people have more pain?
Mm-hmm.
You ever notice that? Okay, why is that? Well, let's talk about that. So basically, you have a spine and nerves that go places and control things. And I'm going to try to draw the best I can. I may have to turn my back to you to draw. I'm sorry for that. I'm left-handed, so the way I've got this position, I'll move and point it out to you. But basically, you got the brain, you got the spinal cord, and then you have the individual nerves that branch off the cord. They go to the periphery of the body, and these are called alpha motor neurons. They control and go to muscles. Now, if you ever could look at the matrix of the fascia around the muscles, it's very, very organized. It reminds me a lot of a intricate spider web, and that these little cross bands, they move back and forth, and these come together and separate, and they're supposed to be smooth, symmetrical movement of the joint. Now, usually what happens is injury occurs either through an immediate trauma, like a car accident or a fall, or bad posture over time, and basically that stresses the muscle. So when you're stressed, the muscles don't relax.
Right.
They tense up. So as these things begin to tense up, they kind of compress together, and they begin to create kind of like these cross-tie scar tissue, and it changes the mobility of the muscle. So that creates inflammation, chemicals. So you get these chemicals that are produced that surround this area. You may have heard of cytokines from COVID days.
Mm-hmm.
That causes inflammation and scar tissue in the lungs. Well, this inflammation basically is picked up by the nerve endings. These are called chemotactic receptors, and these chemicals cause an inbound signal to the spine. Now, if you looked at a cross section of the spinal cord, you have the spinal cord sitting kind of like this right here, and you have these inbound signals that comes in the posterior root. And then normally these inbound signals are sensory in nature. They're picking up the periphery. They go and cross over to the other side, and they end up here in the thalamus, the hypothalamus, and up to the top of the brain up here, where the motor segments are, and they are stimulated to respond down to a signal that comes back in, crosses back over, and it goes out. Now, this is the alpha motor neuron here. Now, these neurons basically come right back over here, and they basically cause muscles to contract and move. Now, if you have this chronic cycle of inflammation, what happens is you have something called a reflex, where the body doesn't like this, so it's trying to protect it. So what happens is you have this inbound signal that comes through here like this, and will actually reflex right back to the same spot. And it's trying to protect the irritation, but it just sort of tightens it up, tightens it up, tightens it up. Now, this uses a lot of energy, and the body's always into this conservation mode. And so what it does is it changes the design of the neuron from an alpha to a gamma motor neuron, which is a higher sensitive neuron. It reminds me of what happens in Atlanta on 285 in the express lane. It gets you through traffic faster, right? But when you're talking about pain and inflammation, you don't necessarily want it to go faster. But what happens is this constant barrage of electrical energy through the spinal cord and the change in the neuron shape is called neuroplasticity, this becomes what we call supersensitized. Supersensitivity occurs as a result of the constant barrage, and the body it's kind of like downshifting. You know, up here, this is like fourth gear, going good. Well, now you're pulling a hill and you're having to go up a greater stress, so the body downshifts to first gear. Now you're slower, but your body's more responsive to the accelerator, right? You can get up a hill, but every time you push on the accelerator, you're jerking your vehicle now. Well, that's kind of what happens in this supersensitivity response. It can, over time, change it to a gamma motor neuron, but it causes this to become so sensitive that even barometric pressure changes in the atmosphere can refire off the signals of pain. So that's the reason why chronic joint problems with scar tissue and fibrotic changes in the muscles are made worse by weather changes because of the supersensitivity. Interesting stuff, right?
Right. I got a question about barometric pressure real quick though. The lower the pressure, the more you'll feel the pain, or like usually if it gets around higher the pressure? Changes
in pressure.
Changes in pressure.
So when the weather changes.
Like if it's going to storm or something.
Well, a high pressure to a low pressure is a change in temperature.
Okay.
Or a change in barometric pressure. So it's just the change that the body becomes sensitive to.
Usually, like whenever it gets cold, I'll have some, pain in my knees or whatever like that. Is it because of the cold, or is
Goes
it?
back up.
You
Your
said
knee has
pressure.
been injured sometime in the past.
Sure.
So you're going to have some degree of sensitivity and scar tissue and inflammation associated with that damage. That's there constantly, bombarding the electrical activity and creating this sensitivity. So it's not the cold or the change in weather, it's the sensitivity and the abnormal. What is this whole thing? Brain, nervous system. It's basically the nerves of the body. And we're going to talk about the concept of vitality and the power and distribution of the nervous system in just a second. It's so critical. It's a good jump to the next thing. So is it the cold weather? No. Is it the barometric pressure change? No. It's the sensitivity to the nerves and abnormal signaling. It's the signaling on the nerves that's creating the problem.
Okay.
So
What
it's
about
the
fibromyalgia? I got a question about fibromyalgia.
Yeah, well, this is the same thing. So this creates what we call fibrosis in the muscle, which is the myo, and the word algia is pain. So fibromyalgia is exactly what we're talking about here.
Okay.
Now, in addition to that, along with this pathway, this goes to the thalamus, the hypothalamus, and it is the location of what we call the sympathetic nervous system. So let's talk about that before we jump too far away, okay? Now, inside the brain and inside the nervous system control, you have certain autonomic nerves that are basically automatically controlling the organ function. So this whole green pathway is the sympathetic system. It is the one that hyperstimulates usually. It's the fight or flight signals of the nervous system. So when your body's under this constant struggle, this signal ramps up, as well as the scar tissue and the cycle of neurological control. The control of that comes from way up here in the thalamus and the hypothalamus in the brain, and basically it has an effect on affecting circulation to the organs and to the organ function themselves. So let's take somebody with fibromyalgia. They have brain fog. They have neurotransmitter issues where it makes it difficult for them to rest and digest and sleep. A lot of their neurotransmitters, their serotonin levels specifically, are found down here in the bowel. So if you agitate the bowel so that they're not operating, you're going to have like hyperactivity and irritable bowel issues that are sometimes associated with fibromyalgia. Sometimes even diagnosed as Crohn's disease or some of the other associated bowel issues that are there but it's because of the nervous system imbalance that's present. It's a complicated problem, but it's based on neurology. So in the body, what we're supposed to have is good signals from the brain to the body. I recently, really just last fall, at a chiropractic conference at my chiropractic college in Marietta, Georgia, heard a Jewish scientist talking about the measure of this nerve right here to the body. This is called the vagus nerve. And they have a way of measuring the output flow of that signal from your brain to your body. And they found that that nerve basically is directly correlated to something that he referred to as a global burden of disease. Let's talk about that for a minute. Global, meaning a worldwide problem, burden, which means cost and suffering, and the diseases that he referred to were many. They talked about cardiovascular problems. They talked about COPD problems associated with COVID, long hauler syndrome and COVID, digestive problems, liver swelling and inflammation, diabetes going to the pancreas, small and large intestine that also affect the serotonin levels in the body, which relates directly to, it's appropriate the sirens are going because this is an emergency situation. You know, you have poor signaling, you're going to have problems with anxiety and depression with serotonin levels being low. So what the medical people do is they'll give you a drug to try to maintain the serotonin levels around longer so they're not recycled as quickly. They're called an SSRI, serotonin reuptake inhibitors, that are designed to take old used up serotonin and keep it around longer. So there's always side effects to those meds. But if you're anxiety and prone or depression prone, you're going to have something to kind of cycle your hormones a little bit, and you're where you don't stay in a hole all the time. Now, those are the mechanistic methods of care. Mechanistic methods of care. Now, what chiropractic is really founded on and is really in the center of is something called vitalistic care, vitalistic health care. So what time is it?
6:44.
Okay, so I want to talk briefly about historically, back in Hippocrates' day. I wished I had looked up ahead of time the original Hippocratic Oath, which said, I'm paraphrasing, that under no circumstances would a physician ever give a dangerous drug or what he called them poisonous drugs, or do surgery under any circumstance on a patient despite their demands. That was the original Hippocratic Oath. It's different now. But back in those days, Hippocrates also said, he's considered to be the father of modern medicine. He also said, look to the spine as a source of disease. And he used the term dis-ease. Dis-ease, which is kind of an important concept. So here you have, back in Hippocrates' days, and you may even remember there was a person who was sick, and Jesus' disciple said, who's the sinner, this man or his parents? And he said, neither. I'm doing this to show you a lesson. It's been hot and cold, and my sinuses are draining myself. So here's the thing. Vitality or vitalism is based on the principle of life that's within us. Where does that come from?
From
It
above.
comes from God. It's an above-down, inside-out process. Innately, that power, that vitality that's within you is designed to work right and to heal you up. Does it require drugs to work? The answer is no. It works automatically when there's no interference. So the vitalistic concept of health is really based upon a principle of energy flow and frequency going from the brain through the nerves to the body so that the body functions properly. Interesting, even current research now in medicine points to a significant importance upon vitalism. And really it points to vitalism as sort of the central hub of why people get healthy, why do they get well, what makes them recover from a problem. It confuses the scientists of medicine because they don't have a real distinct way of measuring or understanding or communicating it. Because if a medical scientist who focuses on the mechanistic point of view of giving you a pill for every problem that you could ever imagine is forced, their hand is forced to talk about vitality and energy and natural healing, then it kind of puts at jeopardy their whole purpose and philosophy. How do they explain that away? They can't. So, this is something that chiropractic has been focused on for really all of the entire career of chiropractic. There's some old drawings from Hippocrates where they would strap people to ladders, and he talked about taking them to the point of a building. They called it the precipice of the building, and they would strap them in, where their head and feet weren't, extended beyond the ladder, and they would literally drop them down off the building to stretch their spines. Kind of like what we did on you earlier today, wasn't it? No, we didn't quite do it that way, but they would actually manipulate the spine by taking them and strapping them and strapping them certain ways to take the twist and shifts out of their spine and drop them and unjam the spine. That was a technique they used and taught back in Hippocrates' day. Ancient Indians and people in the Asian cultures, they had some form of manipulation for thousands and thousands of years. It wasn't until September 19th, 1895 that a deaf man approached a guy named D.D. Palmer, who D.D. Palmer asked him if he could evaluate him. Well, actually, first he said, "What caused you to be deaf?" And he said, "Well, I bent over, heard a pop in my neck, and couldn't hear." And he said, "Can I check you?" He was a type of a healer. Back in those days, they didn't have traditional medical schools. So he was a type of a healer, doctor himself, Dr. D.D. they called him. And he evaluated and found this lump. He called it a lump. And he used his hand and he used the lever of the spine he called it racking the vertebra back in position. And the guy, Harvey Miller's hearing came back. He thought it was amazing. He found the cure for hearing, but then he tested people, and he found, "Well, how's your hearing?" They go, "Huh? What?" Couldn't hear, but he said, "But my diabetes is cleared up. I don't have that heart problem anymore. My digestion is improving. I got more energy. I'm sleeping better at night. I don't ache like I used to." And he started studying this concept, and he basically found that the tone of the nerves, the flow of the energy and vitality had a significant effect. And if you block that tone or energy or vitality, it would have an impact on a person's function. So this is basically the concept of chiropractic. Now, I've got this little thing that I wrote up, and I was going to kind of run through it. And I wanted you to know that chiropractic grew faster in the year 1918 than any time in history. So this first adjustment was 1895. 1910, chiropractic profession was founded. They actually were one of the first groups that embraced X-rays as part of the analysis of spine function. And then by 1918, chiropractic took off, exploded. So what happened in 1918? That was the flu pandemic. They didn't have medicine back in those days for the flu. People were dying left and right. But the people who were getting adjustments would survive. And people heard about that if they were lucky, and they started flocking to chiropractors across the country. And it really expanded the need for chiropractors and chiropractic colleges. So in 1918, the profession started blossoming big time. So current research proves that a better brain-body connection leads to greater survival. For example, if you have a heart attack with poor vagal nerve outflow, this nerve is part of the heart control, and if you have bad signaling to your heart, for example, from the brain to the body part, your chances of surviving a heart attack go way down. Whereas if you have a good signal, better signal, your chances of survival go way up. Same thing with other types of problems. Getting cancer with poor connections results in a less than optimal recovery. Know anybody that's ever had cancer? Do you think it would benefit them to have better signaling cascading from their brain to their body? So with better nerve conduction, better survivability, less cost, less suffering in this global burden of disease. And this is the research scientist from Israel that I heard speaking about this. He didn't even have any chiropractic background. He was just talking about stuff that they had collaborated with physicians and researchers in Great Britain and Canada, United States and Japan. And every one of them found when you have better signaling, you have better function, less suffering. So everything from migraine headaches to cancer to heart disease, long-term COVID effects, digestive problems, diabetes, autoimmune disorders, fibromyalgia, anxiety, depression, all of these are generally managed by drugs. But is there an alternative to drugs?
Yes.
This is what we're talking about. It's better vitality, better flow, better communication. Recent research that's published in talking about posture and alignment with some of the techniques that we're using in our office now, talk about increasing strength and the speed of the nerve signal from better alignment. You get your head posture back, you actually have demonstrable increased circulation to your brain, better blood flow to the brain. You have better reflexes, better strength, better speed. Do you think that would help any athlete? I mean, we're talking professional athletes, we're talking about $1 million contracts potentially. So all of these things are improved, better increased immune response, improved independence and survival. So the evidence is building and building and building. It's all pointing out, I mean, we're at an amazing time in our time today with the understanding of what modern chiropractic is able to do. Just as Hippocrates stated over 2,000 years ago, look to the spine for answers. In all instances, the brain and spinal column has to be the first line of defense. So the role of the brain and spinal cord is to regulate and enhance every action of every organ and including every function of your body. This is coming from an autonomic nerve chart that you can find in any medical textbook. So here's a question. Is there a time in your life where poor brain-body connection would be acceptable? No?
No, never.
So a spinal assessment can uncover many of the possible problems that spinal interference creates within the body. So when people come to me with all kinds of different problems, I try to take it, I want to slow down just a minute. I want to explain to them that what you're saying to me and what your complaints are, I want to hear about, but what we're really concerned about is there interference in this process? Oh, there's a ladybug. That means, oh, I got one up here on me too. Huh. I think that's good luck. Anyway, or blessings coming, I'll take that. So when people come and I talk to them about the fact that you've got to have a problem to have the symptom, and that the problem is the key of understanding the problem, not the symptom, that's kind of what we do. That's how we focus. That's what we're working on doing. And a logical solution would be to choose chiropractic in every instance for any type of health problem. Any type of health problem. So I want to make sure you understand that I'm not just blowing smoke here. I'm talking about research facts and how the body works neurologically and functionally. Chiropractors are primary healthcare providers that are trained to listen and to evaluate the spine. I've spent a lot of time to become a primary spine care credentialed expert. I've been recognized nationally in conferences, because of all the credentials. Today I was back and forth with an attorney group that does continuing education for attorneys, and we're going to be presenting another program. We just finished one 2 months ago, I think. Yeah, that's my bug. I'm not going to get rid of it. It's staying. That's my ladybug. So we're going to do another one in January. So if you know of any attorneys, try to get them connected to what we're doing, because we're going to be talking about evaluation and management of low speed, low impact crashes, and correlating settlements with how, like right now the trend is if your car's not hurt, you're not hurt. That's not the truth. Mm-hmm. And we know why. And we understand the mechanics and the mechanisms of injuries, and it has a lot to do with the new design of vehicles and how the frame is put within the body, and they have these superficial plastic covers that can take a lick, and it still puts the force of the impact into the occupants. And there's as much as 5G times the force of the vehicle that goes directly to the occupant. You like my gun? It's okay, I'm good with that. So, so what we want to do is evaluate you and provide you a complete report so you can understand, and we want to encourage you to give us questions. So you may have questions from what we talked about. You're welcome to come every Tuesday if you want. We require our patients to attend a workshop, actually ideally 2 in the first month and 1 a month after that, and the reason is because we're bombarded with mechanistic information. You know, I say pop, pop, fizz, fizz, oh, what a relief it is. You probably can say, oh, I know what they're talking about. Because of all the drug commercials that we see, we're inundated with that type of thing. And how many people out there knew that I could take a DOT driver who can't pass a physical because of high blood pressure, clear out the top bone in the neck, open up that nerve flow, and drop the blood pressure by 40 points with one adjustment?
It happened to me.
Happened to you. So we do that every time we can't get a DOT driver to pass their blood pressure, to pass them on the DOT physical. We do that almost just about every day. And it's pretty crazy. Even though I've been doing this for a long time, I'm amazed at the results. I mean, I'm just literally, it excites me. And so what I want my patients to be able to be is in control of your own health decisions. I want you to have good information to make better health choices. I think people ought to choose chiropractic. I would love to invite you to come and join us live. Bring somebody with you. We offer guest special invitations to participate in our office, and we'll actually pay for their initial evaluation. So we have a policy. If you bring somebody with you to this event, I'm going to cover the cost of their exam. And we do this every week from 6:30 to 7 on Tuesdays. It's our spinal care workshop. And you can find out more information about everything that we've talked about. And if you have a specific question, man, do we ever have a fixed topic every week?
Not usually. It's
this was
different.
something that somebody asked me Sunday, and I thought, well, we'll talk about some of this.
Right.
Actually, Justin, you asked me about it, and somebody else was asking me. I started asking questions. The next thing you know, we have a talk that we're doing.
I found it interesting that as we were able to cover the weather topics of, about when things are starting to change during this time of the year. When, it was a perfect fit for this week.
Look, people have a lot of immune system issues, inflammatory problems, sinus allergy problems, headaches, joint pains. Look, we just gone from freezing cold last week to t-shirts and short weather today. Man, somebody in my office this past weekend turned the heater on because they were cold, and we didn't check it. We got here, man, I was sweating it was crazy. So we had to turn fans on and, open up the airflow. But here's my statement. This is a new statement. I just came up with this recently. Do life better. Do life better. Choose chiropractic. This is Dr. David Wade. We're terminating our talk. I'll be back with you next week. I appreciate you tuning in. Thank you for coming. I appreciate you coming. Please, you have an open invitation to come back any Tuesday. Okay? We don't talk about the same thing. We'll talk about something different next week. All right.
TikTok, you guys have a good night.